This is what you face every morning before you step outside. Your shoes are always wet and your legs now look like this. This is what we call atlas foot. It is caused by a fungi called dermatophytes. It is also called Tinea pedis. Tinea is another name for ringworm, and pedis means foot or feet. So now that you know what atlas foot is, how is it spread? The fungus loves warm and moist environments. So after matching water outside, like your shoe is wet, you go to work, and then you put your leg in that wet shoe for hours. That's a breeding ground for atlas foot. And then if you are sharing bathroom, you know that you're not the only one using this bathroom. You're always going there. You're always barefooted, going to the bathroom, going to the swimming pool. The fungus loves environment like that. And if you share towels, you share shoes with someone, you share socks, okay, with someone who has infection, that's a very good way to spread it. So apart from the white stuff that you see in between the toes, how do you know that you have atlas foot? Sometimes you might experience itching and burning, that stinging sensation between the toes, peeling and cracking of the skin. Sometimes it might be scaly. Then redness or blisters. Blisters, when I'm talking about blisters, it might have fluid in it. And then there's this foul odor that comes out of the feet. And then thick or discolored skin on the soles. So the first line of treatment is topical antifungal creams. Number one, ketoconazole. For the ketoconazole, there are different brands. You can buy the one you can afford. There's Nizoral, there's Ketofong, there's Ketoral. You can buy any of those ones. Then the second one is clotrimazole. You have Mycotin, there's Canesten, there's Vitacan. You can buy any of those clotrimazole brands. Then the third one is terbinafine. You can buy Tabasil or Lamisil for terbinafine. Then the fourth one is Miconazole. You can use Dactaren for that or any other cheap Miconazole brand. The next line of treatment is oral antifungal drug, and this is only taken if you do not respond to the topical antifungal drugs. 150 milligram once weekly for 2 to 6 weeks. 100 milligram twice daily for 2 to 4 weeks. 250 milligram once daily for 2 to 6 weeks. The following antifungal powders can be used in place of the antifungal creams to keep the feet dry. So for those of you that watched this video and you don't have atlas foot but you want to prevent atlas foot, what can you do? You have to keep your feet clean and dry, especially between the toes at all times. And then you wash your socks daily. Stop wearing socks for 1 month, 2 weeks without washing, especially the guys. And then if you're wearing if you want to buy socks, buy cotton socks. And then change your shoes daily. If possible, like allow them to air out. And then avoid walking barefoot in public places. Then avoid sharing towels, socks, or shoes. And stop wearing non-breathable shoes for a long period of time. Airtight, non-breathable shoes for a long period of time. If you know you enjoyed watching this video, please like, subscribe, and drop a comment down on what you want me to talk about next, and I'll be sure to do it. Thanks for watching.